preparing for combat through fitness, and Fort Stewart medics prepare for disaster. This is the Regional Health Report. Welcome to the Regional Health Report for April. I'm Ann Krebs. The Army Combat Fitness Test replaces the Army Physical Fitness Test in October 2020. Medics participated in a trial run on Fort Eustis, Virginia.
On a chilly morning, medics gathered to participate in a trial run of the Army Combat Fitness Test, or ACFT. The new fitness test consists of 6 events that will test physical readiness. The test is age and gender neutral and will be required beginning October 2020.
Army Combat Fitness Test works on muscle strength, muscle endurance, and just overall body movements that a soldier will typically see in combat, where the APFT is focused just on muscle groups and is not necessarily an efficient test of a truly fit soldier.
The Army Physical Fitness Test was how the Army evaluated physical readiness. The U.S. Army Center of Initial Military Training developed the ACFT to better measure fitness and readiness. This new test is designed to mimic combat tasks and reduce injuries.
We are doing movements and moving under load and getting used to stressing our bodies in a way, a healthy way, that is going to prepare us for the stress of combat when we need to move a casualty, if we need to move ammo cans, when we need to move out after exerting a lot of energy.
The ACFT's events are new, but the soldiers are adjusting well.
I think everybody was nervous, especially in our unit in the beginning, just because they didn't know. Once we did an introductory week and we got them exposed to what they would be doing, there was a lot more interest peaked, and they've really taken their training to another level.
Overall, it's pretty intense and pretty fun.
U.S. Army MEDAC Fort Stewart joined with the Air and Army National Guard in a disaster management scenario. Zach Renstrom has the story.
An 8.1 Richter scale earthquake has brought extensive structural damage to Winn Army Community Hospital, and the facility is no longer capable of completing its patient care mission. The scenario seems like something out of a disaster film. But in reality, it is part of a joint 2-phase multi-service exercise.
It's going to be chaos, but it will be a controlled chaos. The exercise script was specifically designed to create an atmosphere was the greater mode operation.
The ICW team understand the importance of always being ready for any obstacle along the way.
Having the ability and the resources to train and to continue to train daily is getting us ready for whatever that is throwing at us, for whatever the situation will be, so we are ready to go and ready to take action and complete the mission.
The disaster management scenario was just one of the moving parts in the National Interagency Multi-Service Patriot South exercise, hosted by the National Guard Bureau and the Aeromedical Liaison Team.
Our soldiers could be called domestically to help out natural disasters. This gives them the opportunity and training to see how we would mobilize and evacuate patients from our facility, mobilize those patients to a LZ where they would be placed on a helicopter so that they could be taken out of the disaster-stricken area and receive care at a facility outside of here.
During the exercise, members of the MEDAC team would have a specific set of goals that Rodriguez and the exercise planning team would expect the staff to complete during the chaotic scene. The Phase 1 vertical evacuation exercise and the Phase 2 patient evacuation exercise played a pivotal role in the successful completion of the Patriot South mission and the continued readiness of MEDAC. For Winn Army Community Hospital Public Affairs, I'm Zach Renstrom.
In other news around the region, Maria Yeager tells us about a blood drive at Blanchfield Army Community Hospital, Fort Campbell, Kentucky.
A team from the Armed Services Blood Program will conduct a blood drive at the Fort Campbell Soldier Support Center to support service members downrange.
We're with the Armed Services Blood Program, and our mission for DoD is to provide blood and blood products for our warfighters and our healthcare beneficiaries.
Blood is perishable, so the military healthcare system requires 400 units of blood each day to maintain its stock. It meets its mission through the support of military communities.
We can't do anything within the Armed Services Blood Program without the support of our donors.
Up next, security officers have been patrolling McDonald Army Medical Center and its outlying clinics since April 2018. We visited Fort Eustis, Virginia to bring you the details.
MedCom has a new requirement to place security in all its military treatment facilities.
So the safety of our staff and our patients is paramount at McDonald Army Health Center, and I think that's paramount for MedCom as well. We've been very happy to have them on board.
All officers attend the Security Guard Academy in addition to local training.
The training consists of getting guards ready to perform their duties in health clinics, as well as pulling them at the gates. And it was good training, everything from taser to OC spray to handcuffing to APS training.
The McDonald security team most importantly serves as a friendly face.
Welcome home. This is a family, and we got all the assets you need, from security down to healthcare. We're here to serve you and protect you in all ways, shapes, and forms.
That's the Regional Health Report. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on your favorite social media sites, YouTube, and on iTunes. Thanks for joining us.